So I get this question about math tape a lot. A lot, a lot, a lot. Um, and just like you said, certainly a lot of influencers pushing it. And you look and you see, oh, are they getting kickback for this, product? And hostage tape and like terrifying looking stuff. This is my take, and this is exactly what I tell patients is in the absence of having ruled out sleep apnea, using mouth tape, in my opinion, categorically is not only not a good idea, but potentially dangerous, really. If the person has had a sleep study that has ruled out sleep apnea, and we're talking about primary snoring, and they want to try and mitigate that, sure. You want to try using mouth tape and see if it helps? Absolutely. And I'll give them a name of, one of the different phone apps that kind of records snoring decibel levels throughout the night and charts it. Usually I'll tell them to do a baseline with no intervention, no mouth tape in this example, and see what that looks like. Okay, and now let's do it with the mouth tape. So it gives us a little bit more objective data rather than maybe relying on a bed partner to say, oh, you know what, that's really working for you. Or, you know what, there's no change. I don't know what's going on. That's not working. But without having ruled out sleep apnea in the first place, not a good idea, in my opinion.
A couple of things to kind of expand upon what you said. You mentioned rule out sleep apnea. And I know there's a lot of people listening who are going to say, well, my home sleep test was negative, right? And we know that there's certain limitations. So when, Ashtaad is saying rule out sleep apnea, at this point in time, you really need a polysomnogram to be crystal clear that you understand exactly what's going on, or a multi-night test. So in all fairness, you can do a multi-night home sleep apnea test. Either one, has pros and cons to it. But yes, you need more information. One of the things that I talk to patients about, especially when I see that when I have them, I kind of like to have them look up, and I like to look at their nostrils and whether or not when they sniff, do their nostrils kind of stay open or do they collapse? And that's a really easy way to fix some nasal valve incompetence, which I learned that from an ENT. And if you can fix this part and you can breathe a little bit better through your nose, so proving to yourself, like if you have restriction, if you have no air going through your nose, especially in that case, because you've got a deviated septum, you've got a giant polyp in your nose, whatever it may be, some people are really severely congested. You can't use mouth tape if your only other airway is your nose and it doesn't work well. Okay, so number one, yeah, we're all going to be in agreement that's bad. If you can fix some nasal valve incompetence, they have all sorts of cool doohickeys now that I've seen advertised where they show examples of nasal valve incompetence, and then the people are like on TikTok and they're like, oh,
yeah, they're
I
showing
can breathe so much
the
better.
coddle maneuver to say,
Yep.
well, if you can do that and it feels better, well, then you might have this, and you should buy this product.
Yeah. So, I mean, but if you can kind of either use a breathe right strip or, mute or nose event or any one of these things that sort of opens up and stents open your nose, if that works for you for better flow, then it becomes a matter of retraining.
Sure.
I don't like any mouth tape that completely closes off the area 100%. So it always freaks me out when I see these influencers and they've got literally just a taper on their lips and there's no hole, there's no nothing, right? It's your airway. And you don't want to go to sleep with no airway. We are able to breathe both through our nose and our mouth for a reason. Evolutionarily, that kind of kept our race alive. So we should lean into that, in my humble opinion. But for tape that won't, 100% close off your airway, and you're awake, especially to start, you could start to practice what it means to nasal breathe and start to retrain your breathing. But that's a responsible way to do so. And why do I do that? Because I'm still going to rule out sleep apnea, because if I still find the sleep apnea, I know that I'm probably going to find a mask, like nasal pillows that will help to stent the airway open for you, especially if you're blocked. And if you can breathe through your nose better and you're not mouth breathing, I have more options for masks that are not Top Gun fighter pilot covering everything on your face kind of things that people don't like, where they feel like they're wearing a gas mask. And then sometimes I use it as an alternative to a chin strap, again, in that highly compliant patient. But I did a little post that was a little tongue in cheek about it, but the reality is I think there's some utility to it, but just not what these yahoos on the internet are saying it's for. You still need to be tested.
What you just said is the second instance where I like mouth tape. So one is we've ruled out sleep apnea, agree with, what that means, how one might define that with a degree of certainty, right? The other is using it in the place of a chin strap. So the patient has sleep apnea, uses, positive airway pressure therapy, but they're having oral venting. Then again, I think mouth tape, really good solution and great way to, implement and then mitigate that oral venting where the air kind of cycles out of the mouth if their mouth falls open and they're using a CPAP or BiPAP.